Hello again and welcome to PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis.
I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we are the hosts of PodcastDX. This podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen, and never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Attica!
What are you yelling about?
Today's show about Attica.
What? The show is about the film. Oh, it's not about the film, Dog Day Afternoon, nor is it about the Attica prison riots. It's about sciatica, numbness and pain in the lower back and legs. It's the result of pressure on the sciatic nerve.
Oh, so it has nothing to do with Al Pacino or the Al Pacino movie?
No.
Oh, then I'm out.
What was that all about?
Nothing, Ron. Don't worry about, Jean. Ron, why don't you introduce today's guest?
Certainly. On today's show, we are interviewing Mary W. She's an octogenarian, a cookie baker, and yes, she is an Al Pacino fan.
Awesome.
Yes. Hello, and thank you for joining our show. And for the sake of our audience, let me also introduce Mary as my aunt. May I call you Auntie?
Thank you for having me. Yes, you may call me Auntie.
And Mary is also my great aunt, so I will be referring to her as Auntie as well. Hello, Auntie. Isn't this exciting? You are on the air.
Never thought I would be on the air. Will my star be added to the Walk of Fame?
I'm not sure about the Walk of Fame, but you're always a star in our book.
Absolutely.
Since everyone else here is calling you Auntie, do you mind if I call you Auntie as well?
That's fine.
Okay, Auntie, please tell us a little bit about your problem when it first started, if you can remember.
I don't know exactly, but in the family vacation in North Carolina about 5-6 years ago, I noticed my upper leg was tingling and I thought I had blockage, like the blood wasn't flowing through.
Well, that must have been scary.
Yes, I was very nervous. I thought it might be something serious. I never had that before, so I didn't know what it was.
Were there any other symptoms at that time?
No, but when I was standing for long periods of time, it would affect me more.
Well, what did you do about it at the time?
Nothing. I sat a lot. I just tried to rest since I was away from home. I knew I would have to be checked when I got back to Chicago.
So when you got home, you saw your doctor?
I ended up going to the chiropractor. Lita probably suggested it since I have been there before.
I vaguely remember that. It certainly sounds like something I would do.
Did the chiropractor help at all?
No, not really. They told me to do my exercises, and I didn't have to go back. I did one exercise for a while, and it didn't seem to help, so I just stopped.
So it just continued to bother you?
Yes, the pain wasn't bad. It was really just annoying numbness, but not really excruciating pain, so I dealt with it.
Well, I could understand that. I guess if it's just annoying and it's not really painful, then you just deal with it. Now, that was a long time ago, 5 or 6 years. Can you bring us up to speed on what's going on now?
Within the past 6 months or so, my symptoms changed, and now on top of the numbness of the right leg, I have pain in the lower back and hips. I ended up going to my GP, who ordered x-rays on my hips, and I was worried that I might need hip surgery. The pain has been pretty bad, even keeping me from parties and socializing. It hurts to sit or stand, so I end up spending a lot of time on the couch with a heating pad.
I'm so sorry to hear that. What did the x-rays show when you had those x-rays done?
My doctor called me and he said that the hips were fine. It was just that I had sciatica.
Well, I bet that was a relief to you.
Yeah, she told me that I should get on my back and do some exercises. And then I told her, are you going to come over to help me up?
Well, yeah. And I think I recommended that you do the exercises in bed.
That is what I have been doing. It has been helping.
Well, what kind of exercises are these that you're doing in bed?
I don't think she's going to be showing you what she does in bed, Ron. Sorry.
Several stretching moves. I have pictures.
Well, I'm going to post those pictures of the
boy.
exercises. Not Auntie's, just
okay.
generic exercises on the website for everybody to see. They're very typical physical therapy movements.
Okay. Well, Auntie, I'm glad that it wasn't your hips because I know that hip replacement can be, is rather common, but it's kind of extreme. And anytime you can avoid surgery, you're better off.
Yes, indeed. I hope sharing this information can help someone else that has sciatica. I read a lot of people have this.
Oh, they absolutely do. There are more people than you would think that suffer from sciatica. 6% of the general population have complained about this problem. Most of them get it when they're in their 40s or 50s. And the first time it was ever mentioned in medical literature was in the 1400s.
Yeah, that was a few years before my time.
Before all of our times. But it is a bit of a relief knowing that it's not uncommon. I would like to read the definition for sciatica. About 90% of the time, sciatica is due to a spinal disc herniation pressing on one of the lumbar or sacral nerve roots. And it is a medical condition characterized by pain going down the leg from the lower back, and the pain might go down the back, outside of, or front of the leg. Onset is often sudden following activities like heavy lifting, though you might also have gradual onset. And typically the symptoms are on only one side of the body, but in certain cases, you might have pain on both sides. And lower back pain is sometimes but not always present, and weakness or numbness may occur in various parts of the affected leg, so it's probably just best to see your doctor.
After meeting with your doctor, you found out that stretching exercise would help. I have also heard strengthening the core, the abdomen, is a good way to keep the spine safe from injury. I guess we should all take a lesson from this and keep our core strong. There are some tips and equipment that might just help do that.
Exactly. Auntie, you're in good company. Olivia Newton-John recently went through treatment for sciatica, and JFK had terrible back pain throughout his life. I'm glad that you found out what was the actual problem, and now you can have it treated. We want to thank you again for sharing your story with us today. We all hope that those stretches can help you find relief.
Thank you for having me.
It was great having your Aunt Mary here to talk with us about sciatica. I think we should discuss the relationship between sciatica and arthritis.
That's a good idea, Ron, especially since next week's topic will be covering arthritis. This will act as a good lead-in to that topic. The sciatic nerve happens to be the longest and largest nerve in the body. It starts in the lumbar region of the lower back, and it works its way under the gluteus muscles in your butt and down the thigh and leg.
Yes, and any irritation of that nerve will cause the pain that Auntie Mary was talking about with her sciatica. According to the Arthritis Foundation, osteoarthritis can involve the lumbar spine by the formation of osteophytes, or bone spurs, forming on the vertebra, the facet joints on the sides of the spine, or even on the inside of the spinal canal.
Right, and I will post more detailed pictures on the page of our website dedicated to this topic. But to try to give you a visual right now about what we're talking about, an osteophyte looks like a ragged edge of the bone rather than the smooth edges that we're born with. That ragged edge causes the pain as it puts pressure or irritation on the nerves near that edge.
That is probably a great idea to post pictures. It's hard to imagine all of these body parts in your mind. With the osteophytes that occur on each side of the spine and within the spinal canal itself, the sciatic nerve has a good chance of being irritated. Isn't that right?
Yes, Ron. And that's what they call spinal stenosis, or narrowing of the nerve pathways because of these osteophytes.
Well, that makes sense. Is this something that just happens with age, or how do you avoid it?
No, it doesn't necessarily only happen with old age. It's not really an old age disease, though the incidence does increase with age. Young people that have repetitive injuries in sports can develop it. Hemophiliacs that have bleeding disorders can have it due to a lack of oxygen-rich blood supply and death of the bone tissue. And certain occupations that require kneeling or squatting, climbing stairs, that can also cause osteoarthritis. But as we age over time, you may have wear and tear on different joints, which can also cause it.
That does mean taking care of yourself as you go through life. Staying fit and healthy is always a good idea.
Exactly. Everything in moderation. Avoid putting too much stress on any one joint or set of joints, and avoid repetitive activities that only use one set of joints, such as kneeling. As far as sciatica pain goes, or sciatic pain, there are simple things you can do at home, such as using cold compresses or heat, whichever works for you. Usually during the acute phase of symptoms, cold compresses on the affected buttock for 10 to 15 minutes, 3 to 4 times a day, seems to work best. You can even use a bag of frozen peas wrapped in a towel. Heat, such as warm compresses, may be preferred by some patients, especially if used a couple of days after the initial episode. Of course, always ask your doctor and see your doctor if you start having any unusual pain in any joint, and if the pain does not resolve in a day or so.
Well, since we're going to cover arthritis more in depth next week, maybe we should just wrap this up now?
I second the motion.
Okay, I can take a hint. If you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, or on our Facebook page, Twitter, or Instagram.
And if you have a moment to spare, please give us a 5-star review on the iTunes podcast app.
Till next time, I'm Jean Marie.
I'm Ron.
And I'm Lita.